In this video, we will review the results of the second part of our study, which compared the outcomes of patients who received a liver transplant versus those who have been treated with diet and medicines. We will first describe how we performed this research study. Who did we select as participants of the study? What outcomes did we look at? And how did we find comparable groups of patients who are treated either with diet and medicines or with liver transplant? We will then summarize the results of our study and then also discuss our future plans. How was our study performed? First, we had to find a group of patients with urea cycle disorders. We started with the participants enrolled in the natural history study of the Urea Cycle Disorders Consortium, or UCDC. The UCDC consists of a team of scientists, healthcare professionals, and patient advocates working together to improve the lives of people with urea cycle disorders. The UCDC has sites mostly in the United States, but has international sites in Ontario, Canada, Switzerland, and Germany. The UCDC Natural History Study collects health information over time from people who have urea cycle disorders and is the largest study of its type. Some people in the study are treated with diet and medicines, and others have had a liver transplant. Although this was a good place to start, we wanted to add even more patients to our analysis. Through the help of the National Urea Cycle Disorders Foundation, we also found and included patients not yet enrolled in the UCDC study. We also reached out to another organization, the Society of Pediatric Liver Transplantation, to help us find even more patients. From this very large group of patients, we only selected patients with neonatal onset UCDs for our analysis. As we explained in our first video, patients with neonatal onset UCDs are entirely missing an enzyme, therefore they have very severe disease. We picked this group because we expected that all neonatal onset UCD patients would therefore at some time in their lives be given the choice of whether or not to get a liver transplant. Also, we only included patients in our analysis who were treated in the US and Canada. We included patients from Canada because the treatment of UCD patients in Canada is very similar to treatment in the US. On the other hand, the medical management and the availability of liver transplant in other parts of the world is often different than in the US. We looked at 3 outcomes. First, we looked at survival. In other words, if patients are still living and how old they are. Second, we looked at quality of life. We collected data from standard questionnaires filled out by patients and parents. These quality of life questionnaires asked about the physical, emotional, social, and school functioning of patients. They also asked about the impact of the patient's health issues on the family, such as the impact on the daily family activities, the health of the relationships between family members, and the mental and physical health of parents. The third outcome we looked at was thinking skills and brain functioning, as determined by psychologists who are experts in child development. By assessing how patients think and learn, these experts are able to determine each patient's strengths and weaknesses in different areas of brain functioning. The areas assessed included motor skills, language skills, problem-solving skills, memory, attention and focus, and emotions and behavior. Now that we narrowed down the group that we wanted to study and what outcomes we wanted to study, what was the next step in our analysis? Well, next, we had to find comparable groups of people with UCD who were treated with diet and medicines or who received liver transplant. Why is this important? Let's use an analogy to explain why. Let's say you were planning a basketball tournament. If most of the teams were made up of children, but one team had an adult professional basketball player, this would not be a fair tournament. Age is an important factor when comparing basketball teams. Most basketball tournaments for children only allow children with a certain age range to participate. This is important in order to make the competition fair. In other sports, other factors can also be important. For example, in wrestling, age, gender, and weight are all considered when setting up a fair competition. In the same way, when comparing the two groups of patients treated with liver transplant or diet and medicines, we needed to make sure that these two groups started off similar and that the comparison was fair. Some of the factors we took into account were the UCD type, in other words, the specific UCD enzyme that didn't work, the highest ammonia level, the number of hospitalizations for high ammonia, and the length of hospitalizations. These factors were used to calculate a combined severity score for each patient. Once the score was calculated for each patient, all the patients could then be ranked according to their severity score. When we looked at which patients had received liver transplant and which had received medical management, there was a difference in severity. Those who received diet and medicines alone, on average, had a lower severity score than those who received liver transplant. In other words, those who received diet and medicines in general had lower ammonia levels and fewer and shorter hospitalizations than those who received liver transplant. In fact, there were 35 patients treated with diet and medicines who had a lower score than anyone in the liver transplant group. Also, there were 43 patients who had received a liver transplant who had a higher score than anyone in the group treated with diet and medicines. We could not include these people in our comparison analysis because then the comparison would not be fair. To go back to a wrestling analogy, it's like we had to exclude the kids who are too young and too small or too old and too big from this competition. This left us with 109 people with UCDs, 58 with liver transplant, and 51 who were treated with diet and medicines for our comparison. What were the results of our study? First, liver transplant very clearly prevented any further high ammonia episodes. But how about the outcomes of survival, quality of life, and brain functioning? Because we had a smaller group of patients than we anticipated in our comparison analysis, we could not show that there were statistically significant differences in outcomes between the liver transplant group and the group treated with diet and medicines. Statistically significant is the scientific gold standard that represents beyond reasonable doubt. In other words, we could not show beyond reasonable doubt that there were differences in outcomes between the medically managed and liver transplant groups. But we do have some evidence of some differences in the outcomes. When looking at the results of the quality of life questionnaires, there was a trend towards improved family impact scores in the liver transplant group as compared to the group treated with diet and medicines. This means that families of patients who had liver transplant seemed to overall report fewer problems with daily family activities, better relationships between family members, and better mental and physical health of parents. When looking at thinking skills and brain functioning, there were no major differences in any specific category, but there was a trend towards slightly better overall brain functioning scores in those who received liver transplant. Also, among those who received liver transplant, there was a trend towards slightly better overall brain functioning scores in those who received a transplant before 1 year of age as compared to after 3 years of age. Higher overall scores usually means a person will perform better at school and be more independent in their daily life. Although we could not prove these differences beyond reasonable doubt, we performed 2 different analyses with the same data, and these 2 different approaches reported the same results. The trends we found of improved family quality of life and improved brain functioning with liver transplant, especially with earlier transplant, also matches with what families and healthcare providers reported to us in the interviews and focus groups that we talked about in our second video. We think more patients would have been needed to prove beyond reasonable doubt that there are differences in the outcomes of patients treated with liver transplant or with diet and medicines. But as we described in this video, this study already included the largest group of people with UCDs. We think it would be very difficult to gather an even larger group of people with UCDs because UCDs are very rare. We therefore wanted to share our results with the UCD community because we thought many families and healthcare providers would be interested in learning about our results and the trends that we observed, even if we could not prove any differences beyond reasonable doubt. Still, we think more research in this area is needed, and this research will help us better understand the impact of diet and medicines or liver transplant as treatments for UCDs. It's also important to remember that the results of our study do not apply to all families with neonatal onset UCD. Remember, we excluded patients with very mild or very severe disease in our analysis. So for example, if a patient has ever had ammonia levels over 400 micromoles per liter or has never had ammonia levels over 150 micromoles per liter, then the results of our study are much less likely to apply to that patient. In fact, for patients with very mild disease, liver transplant may not be an appropriate option. In the same way, for patients with very severe disease, continuing with medical management may not be the best choice. As we have shown in these videos, choosing between medical management and liver transplant is a very complex decision. We think it's important that each family talk to their healthcare team about whether the results of our study apply to each patient and whether continued medical management or liver transplant is an appropriate choice for that patient. We also provide some links to articles or websites of interest in the additional links section of our app. We would like to thank all of the patients, families, and healthcare providers who participated in our research study. We also thank you for downloading our mobile app and for watching our videos. If there are specific questions that you still have related to the results of our study, please submit these in the questions section of the app. We will answer selected questions in 2 follow-up Q&A videos.